Today's video is about AMH testing. AMH testing, also called as Antimullerian hormone. Antimullerian hormone test. When is AMH tested? AMH is basically tested while evaluating for infertility. It is basically used to calculate the ovarian reserve. Ovarian reserve means the total number of eggs which are present in the ovary at that point of time. It is also used for IVF procedures, and it's also used for the diagnosis of menopause. These are the most common reasons why AMH gets tested. The first one being, the most common being to test for the ovarian reserve, and the second one for the IVF testing, and the third one to diagnose menopause. Even though females are born with 1 million eggs, it's very unfortunate to see only 300 to 500 eggs are actually useful. All the rest of the eggs will be degenerating very quickly. The way it goes is like if you plot a graph over here, with the y-axis being total number of eggs and the age. Say this is at birth, puberty, this is menopause. If you see the counts of these eggs at birth, they'll be having the maximum, and by the time they reach puberty, it's almost 50%, and by the time they reach menopause, they reach actually 0. Say a woman in 30s wants to make a correct decision whether to start a family like right now or to wait for a while. AMH is a test which will be helpful in making correct decisions. So basically the doctor orders AMH in these scenarios, and if the levels are adequate, she can wait for some more. She still has some more time. If the levels are inadequate, maybe she need to start the family quickly, or she does have an option of freezing the eggs and using them later. Another most common use of AMH is in IVF procedures. In vitro fertilization, basically what is happening in this IVF is like you have an egg over here, and they take the sperm and they fertilize in a petri dish, to form an embryo. And they transfer this embryo into the uterus of the female. During the IVF procedure, usually the patient will be given gonadotropin. It's interesting to see how this gonadotropin acts. Basically, this gonadotropin stimulates the ovary to release eggs. So how is AMH useful in this particular scenario? AMH is helpful in determining the responsiveness of the ovary. Patients who have reasonably good amount of AMH levels are called as highly responsive. And the patients who have low AMH levels are called as poorly responsive. How are they different? Highly responsive females are the ones who may be reading a little bit lower dose of gonadotropin, while poor response people require little higher dose. Dosage is very significant in the IVF procedures because one of the most common issue associated with IVF is ovarian hyperstimulation syndrome. Ovarian hyperstimulation syndrome. It is a small discomfort which can occur during the process of IVF. By knowing the levels of AMH, the responsiveness of the ovary to gonadotropins can be identified accurately, and ovarian hyperstimulation syndrome can be avoided to an extent.
Even though menopause is diagnosed clinically and by the determination of follicle stimulating hormone FSH, in menopause follicle stimulating hormones will be extremely high. Recently AMH is also used as a marker for menopause. The levels of AMH are extremely low in menopause. Based on the levels of AMH, ovarian fertility can be of 4 different kinds: very low, low, satisfactory, and optimal. In very low values, in very low category, usually the levels are less than 0.29, whereas in lower category it will be between 0.3 to 2.1. Satisfactory levels are anything in between 2.2 to 3.9, and optimal are anywhere between 4 to 6.8. All the values are determined in nanogram per millimeter ml. So based on the levels, it can be broadly divided into 4 categories of ovarian fertility. However, these are subjective to the method in which the test is performed, and we just ideally it is recommended to refer the normal reference which is given by your lab.
So how do you interpret the results? How do you interpret the results? The values can be either high or low or poor. Adequate levels or adequate to high levels indicate good ovarian reserve, whereas low or poor indicates poor ovarian reserve. Sometimes high levels are also seen in polycystic ovarian syndrome. However, the values need to be strictly correlated with your clinical presentation. The results need to be interpreted based on the particular clinical scenario. Please post all your queries in the comment section. Like always, we try to answer as many questions as possible. Also, please don't forget to subscribe and share.